Hi, this is Courtney Austin for Nursing 693, Population Health, presenting to you health issues in rural populations. What is considered a rural population? When I think of rural populations, I think of vast fields and intermittent housing scattered throughout. The U.S. Census Bureau defines rural as what is not urban, that is, after defining individual urban areas. Rural is what is left. Again, the U.S. Census Bureau reports that rural areas cover 97% of the nation's land area, but contain 19.3% of the population, which is roughly 60 million people. Chronic diseases are more prevalent in rural populations versus urban populations. As you can see, this diagram shows a notable difference of prevalence for high cholesterol, high blood pressure, arthritis, depressive disorder, diabetes, chronic obstructive pulmonary disease, or COPD, and heart disease. Asthma is the only chronic disease that appears to be more prevalent within urban populations, considering the diagnoses that are listed in this diagram. Rural disparities in adolescent smoking prevalence is a study that was conducted by Soo-Young Kim and Ariel Celia to determine if rural disparities contributed to the prevalence of adolescent smoking. This study retrospectively examines the 20-year trend of differences in smoking between rural and urban youth, and it demonstrates whether there is a need for anti-smoking interventions targeted to rural adolescents. Data was collected from reviewing surveys that were done by 12th graders from the years 1998 to 2018. The findings were not at all shocking. The geographic disparity between rural and urban adolescents represents a potentially modifiable cause of increased morbidity and mortality in rural areas. Therefore, there is need for anti-smoking and smoking cessation campaigns that will reach this group of individuals to decrease their chances of developing a tobacco-related chronic disease. However, this is not an easy task due to the many barriers for those who live in rural areas may face, especially when trying to seek medical attention. Smoking is an addiction that is not easy to kick. However, it is important to encourage all smokers to do so. Some of the tobacco-related diseases one can develop from smoking or inhaling secondhand smoke include chronic obstructive pulmonary disease, or COPD, hypertension, cardiovascular diseases, atherosclerosis, diabetes, cancer, or a microbial infection, including respiratory tract infections and bacterial meningitis. A few facts about smoking include the following. Every day, almost 2,500 children under the age of 18 try their first cigarette, and more than 400 of them will become new regular daily smokers. In 2020, nearly 7 of every 100 middle school students, about 6.7%, and about 23 of every 100 high school students, which is roughly 23.6%, reported current use of a tobacco product. If current tobacco use patterns persist, an estimated 5.6 million of today's youth under the age of 18 eventually will die prematurely from a smoking-related disease. During 2019 to 2020, current use of any tobacco product, any combustible tobacco product, multiple tobacco products, e-cigarettes, cigars, and smokeless tobacco among middle and high school students decreased. Tobacco-related illnesses are leading causes of death and healthcare use. As a nurse in the emergency department in a rural setting, it is common to see patients that are experiencing an exacerbation of a disease that was caused by smoking. In my experience, a majority of these patients are current smokers at the time. A study done by Greenwood, Erickson, and Kocher found from the years 2005 to 2016, rural ED visits increased 50%, from 36.5 to 64.5 per 100 persons, compared to urban ED visits that were barely changed from 2005 to 2016, with a slight increase from only 40.2 to 42.8 visits per 100 persons. Previous studies suggest that poor primary care access is associated with increased ED use. With rural patients less likely to have a primary care follow-up visits are more likely to have an ED visit following an inpatient admission. Tobacco-related chronic diseases result in increased need for medical treatment and management. Previous studies have shown increased cessation rates for patients who accurately perceive that their ED visit is smoking related. It is important to evaluate all patients for their smoking status. If currently smoking, educating the patient on the importance of smoking cessation is vital. For the patients that reside in rural areas and may not have adequate follow-up with a primary care physician, it is important to address this while they are in the emergency department. Treatment options include medications and therapy. However, it is more effective to receive medication and therapy congruently. There are also many online resources available, along with quit lines that one can call for support in smoking cessation. In conclusion, adolescents in rural areas have a higher prevalence for smoking. Smoking leads to chronic tobacco-related diseases that will require more medical care and treatment over the average person's lifetime. Therefore, more emergency department visits and hospital admissions for management they may have been avoided if they had stopped smoking. With that said, it is important to evaluate all patients for smoking status and implement a plan for smoking cessation as soon as possible. These are my references, and I thank you for listening.